This wildfire season is especially different with COVID-19. So today we're talking with air quality and health experts about the best ways to protect you and your family from smoke during this unique season. Let's begin with air quality and Lisa Woodard with Spokane Regional Clean Air Agency. Lisa, what is in wildfire smoke and how is it measured?
Well, smoke is a complex mixture of gases and fine particles. And the biggest health concern is the fine particles. They're microscopic. We refer to them as PM 2.5. The 2.5 is the size of the particle, it's 2.5 microns in diameter or smaller. Now, just for perspective, a human hair is about 70 microns in diameter. So these are ultra small microscopic particles. And that's the problem. They get lodged deep into our lungs where they can damage and scar lung tissue. So, air quality agencies like Spokane Regional Clean Air sets up monitoring stations throughout their jurisdiction to monitor the ambient outdoor air. And that information is then gathered and sent out to the state, to EPA, and to our local website. And measurements are taken around the clock.
And how are these measurements reported?
So the raw data from the monitors, for example, with fine particles, it's in a microgram per cubic meter of air, which doesn't mean a lot to people. So the concentrations are converted to a national standardized color coded scale called the Air Quality Index. The index runs from 0 to 500, 0 being very good air quality and 500 being very harmful, very hazardous. So the scale goes from 0 to 50 would be considered good air quality or green. 51 to 100 would be considered moderate air quality or yellow. Anything over 100 on the air quality index, you're getting into the unhealthy ranges. And that's when people need to start taking some actions to protect their health.
And where can people find this information?
Current air quality can be found a lot of places. Our website is one, SpokaneCleanAir.org. There we provide a current and a 2-day air quality forecast. In addition, on that site, you can find links to the Washington State Smoke Blog, which provides statewide information about smoke and fires. You can also find a link to EPA's airnow.gov. That is a great location to check out air quality across the country if you're planning to travel places. Also, it's where you can sign up for text alerts and email notifications.
Now let's talk about the health effects of when smoke from wildfires is causing air quality to decline with Kelly Hawkins from Spokane Regional Health District. Kelly, what are the health impacts of wildfire smoke overlapping with COVID-19?
Yes, breathing in wildfire smoke can cause a variety of symptoms, ranging from eye, nose, and throat irritation or headaches to more severe symptoms like shortness of breath, chest tightness, and the worsening of existing chronic condition. Some of these respiratory symptoms, including cough, sore throat, and difficulty breathing, are also common in COVID-19. Both wildfire smoke and COVID-19 impact our respiratory and immune system. If you already have COVID-19, breathing in wildfire smoke may make your symptoms and outcomes worse. Or if you don't have COVID-19, it may make you more susceptible to getting it.
Are there groups of people more sensitive to wildfire smoke and COVID-19?
Yes, people with heart and lung diseases, people with respiratory infections, people with diabetes, stroke survivors, infants, children, pregnant women, and people over 65 years of age are more sensitive. Some of these groups are also those more at risk for COVID-19. Those with or recovering from COVID-19 may also be more at risk for the health effects from wildfire smoke exposure.
Now let's talk with Caitlin Kelly from Washington State Department of Health. How can people protect themselves this season considering COVID-19?
The season is going to be different. The best way to protect yourself will be to stay indoors and keep your indoor air clean. This is especially true when it might not be safe for people to go to public spaces to seek cleaner and cooler indoor air outside of their home due to the risk of COVID-19 transmission. So, to keep the air in your home clean, reduce the intake of smoke into your home by closing windows and doors and setting air conditioners to recirculate. And then don't add to indoor air pollution by not burning candles or incense, smoking, broiling or frying foods, or vacuuming. And then finally, take steps to improve filtration to your home by considering a couple options. You can make improvements to your HVAC system if you have one. You can buy and use a portable air cleaner with a HEPA filter, or finally build and use a DIY box fan filter.
What about face masks like N95 respirators and cloth face coverings?
Face masks in general are not the primary recommendation to reduce your exposure to wildfire smoke. The other options I previously mentioned, we encourage taking those steps first. But if there is a need to use a face mask for a limited duration outside, an N95 or a NIOSH respirator rated for fine particulates is usually recommended, with steps to make sure it's worn properly. However, with COVID-19, these N95 and other respirators are in short supply, so they do need to be saved for those required to wear them for work, like healthcare and frontline workers, where they have an increased risk for COVID-19. And unfortunately, our cloth face coverings that we do wear for COVID, while they're important to continue to wear to slow the spread of the virus, they unfortunately do not provide much protection from breathing in wildfires.
I'd like to thank the three of you for sharing this important information today. Much more information about air quality, wildfire smoke, and health can be found on these partner agency websites.